Doctors and nurses confess most embarrassing sex injuries they've ever seen. Medical professionals have shared some of the most embarrassing and painful sex-related injuries they've ever seen. It's no secret that sex can be incredibly awkward, but for some people it can also result in a rather embarrassing trip to the hospital. According to escort agency xstasy.co.uk, more than 24 million people visited A&E in 2018, and over 3.5 million of these visits were for an intimate injury caused by sexual activity. The most common injuries included popped blood vessels and a broken, fractured penis. But how do these injuries occur? Doctors and nurses have been revealing all in a thread on Reddit. Someone posted on the site asking medical professionals to reveal the most embarrassing sex-related injury they've ever seen. And they did not hold back with their responses, some of which will make your eyes water. One person said, "I'm an EMT and one time we transported a lady who had 3 hot dogs in her vagina and they had been in there for 3 weeks. She said it started to get a bit uncomfortable, so she decided to call the fire department. Took a look and there was a rotting hot dog peeking through, like that scene from Role Models with Jane Lynch and the corn dog." Another commented, "My partner is a nurse, and once had to extract a crunchy, a honeycomb chocolate-covered bar, that got lost in a woman's vagina. I do not envy his job." Similarly, a nurse admitted, had an older gentleman come into the ER around 2 a.m. for constipation. The doctor ordered an X-ray per usual. Results come back, soy sauce bottle shoved up his butt. Doctor explained he would need to go to the operating room to get it out, and he promptly signed out and left. Someone else had seen far too many sex-related injuries in their job. They said, had numerous men with candles, torches, foreign objects which they fell onto. The worst was a toilet brush, which perforated his bowel. Major surgery, wife calling the ward who we couldn't give any info to on his orders, she was not a happy bunny. Also had an older lady, with a ceramic cat inside her vagina. After reading through some of the sex-related injuries from the thread, Dr. Stephanie Uwe from My Healthcare Clinic shared some advice on what to do if you are ever unlucky enough to find yourself in a similar position. Here's what she had to say. General penile emergencies. In general, penile emergencies are fairly rare, but when they do occur, I would recommend seeing a doctor urgently for diagnosis to see if any further treatment is required. Most conditions are caused by trauma to the penis during sexual intercourse or masturbation. Other injuries could be caused by infection or vascular issues. Popping blood vessels is rare, but there may be other acute injuries which may signify a significant blood vessel rupture, include edema, swelling, or discoloration from bleeding under the skin. This is normally caused by vigorous sexual intercourse or forceful manipulation of the erect penis. You may need to attend A&E to check there has been no further damage, but swelling and discoloration should fade within a few days to a few weeks and should cause no long-term issue with erectile function. Broken, fractured penis. A broken or fractured penis refers to a rupture of the corpora cavernosa, erectile tissue which runs the length of the penis, and the penile sheath. This can be a painful injury and can have a long-term impact on sexual and urinary function, therefore it is important to seek medical attention urgently. Symptoms include bruising, difficulty urinating, bleeding from the penis, hearing a crack or pop, and sudden loss of an erection. Injuries are often caused by rough sex. Treatment can vary depending on the damage, however, it may be necessary to operate to avoid complications.